Yesterday, BC had the highest COVID case count of any province in Canada. Epidemiologists are estimating that the reproductive rate of the Delta variant is around 6. They're saying that it likely can't be controlled by vaccines alone unless we get a really, really high vaccination rate, like 90% of the entire population or more. And yet in BC, we have few other control measures currently in place. So it's a twofold question. Are you at the point where you're just going to accept widespread infection of unvaccinated people? And also, what is your plan for handling the fourth wave?
Yeah, so I think you need to understand when you have rates, when you have low numbers and you do extensive contact tracing, as we're doing, people, it is expected that we're going to identify clusters of people who have been in contact with each other, and this reflects those transmission events that have happened over the last week to 10 days. So yes, we expected that we were going to see increased numbers of cases, and we've taken additional measures in those focal areas where we're starting to see that high increase. We're also, as you know, have small clusters of cases in other parts of the province. But what we're not seeing, and that is what we have been monitoring very carefully, is we're not seeing the widespread transmission to people who are at risk that we've seen in the past, and that is because we have such high rates of immunization. And if you look at our immunization rates by age group, it's very high in the older age group, the people who are more at risk of hospitalization. And so there's a lot of different factors that go into what we need to do. We've taken additional measures in the areas, the hotspots, where we're seeing case rates rise, particularly in unvaccinated people. And yes, we are pushing very hard to make awareness that the important measure that we have now to manage outbreaks is immunization. So the modeling looks at a number of different factors, and we've been looking at the models as well. And we know that Delta is one of the factors. It is more transmissible, and that means that we need to have even higher rates. But even a small increase in immunization in different age groups can make a huge difference. So yes, we're following that carefully as well.